Hey guys, today I'm here showcasing and highlighting a spotlight, one of my heroes, Dr. Azadi, who is an internal medicine doctor right here in Austin, Texas. I've had the privilege of helping her find a commercial space where she can grow her business and provide the healthcare value and needs to all her patients. Not only that, she's also a top doctor 3 years in a row in this industry. We're stepping into the world of healthcare as we visit esteemed Dr. Azadi internal medicine practice. Join me as we discover the passion and dedication behind this vital local business. Dr. Azadi is also a motivational public speaker and specializes in providing digested medical information and facts to public to help promote a healthy lifestyle. As I step into this office, you can just automatically notice the warm, healing component of an office. Not just a medical office, it's a private office that is just a wonderful place for patients to come by and just be greeted with care and love. Thank you for letting me be in your office. This is a wonderful place for patient consultation. Can you tell me a little bit about what services you offer?
Sure, absolutely. We offer a wide variety of services to the patient. We of course do comprehensive internal medicine services such as preventative care, which includes yearly physical exam, wellness exam, well woman exam, and sport physical. We also take care of the acute care, usually the same day and the next day, because we do not want our patient to really end up in the ER or urgent care. We take care of the chronic disease conditions. We do diagnostic testing and laboratory testing. We are very big in providing wellness and weight loss management to the patient, whether it's in terms of medication such as Contrave, Topomax, or phentermine, or injectable medication like Ozempic, which is the same thing as semaglutide. Patients know that as semaglutide. We also have another wing of the practice where we provide hormonal replacement therapy for men and women, and again that comes in terms of either pellet, injectable, or oral medication. And we do IV hydration, and also we provide cosmetic services such as traditional botulinum toxin injection, filler injection, and a host of laser services. So our goal is to provide a comprehensive health care to meet the unique needs of each individual that walks through the door.
Wow, that's impressive, Dr. Azadi. I did not actually know that there are so many services being offered at your own clinic right here.
Yes, at the site, we provide everything at this site.
Oh my gosh, I love it. And I'm sure people that are watching will also love all the services. It's not just your annual examinations, your day-to-day healthcare needs, but it's much more.
Definitely. We're trying to really be as comprehensive as we can, so we can cover everything under one umbrella, and patient doesn't have to be going to different places to get their health care.
Yes, which is wonderful because you have one doctor that knows everything about your health conditions. It's you can treat from anywhere from basic health care to cosmetics to anything, weight loss, and they have all the information, and not going through different doctors, which I feel is so easy for patients' mental health being too.
Exactly, it's really a headache, and then the healthcare will become fragmented when you're switching from one doctor to another doctor, because there's no communication between the doctors. So I really think it's best to keep, all the healthcare of one patient under the same umbrella.
Yes, which is so important in this age of the world, because communication is the key in everybody's healthcare. Just as well-being, right?
Exactly. The mental well-being, and the physical well-being is very important at the same time.
I love it. So guys, if you are in need, make sure you reach out to Dr. Azadi. But that being said, let's go ahead and check out some other services that she has to offer.
So this is one of our rooms that we do lots of cosmetic and state-of-the-art procedures here. We have the emerald laser, which is the only FDA-approved laser for fat loss removal, believe it or not. So it's sort of a fat loss without doing a liposuction. Then we have the photono laser, which is practically horsework of all lasers, and it does a lot of stuff, including, believe it or not, doing a photono 4D. So we treat the patients from inside the mouth to the outside to do a lift. It treats snoring and a lot of medical condition, sculpting, skin tightening, wart removal, lesion removal. So with one laser, I can do a lot of procedures, with the patients.
What is one thing that people come to you?
I get a lot of wellness patients for weight loss. So I do combination of medication and I do the emerald laser, for weight loss. I also get hormonal replacement therapy, and I get a lot of demands for photonal laser, especially when it comes to snoring and doing a lift and skin tightening. So I do quite a lot of that. Another service that I get a lot is Botox and filler injections, actually. But in a day-to-day basis, I'm still doing my internal medicine, so 50% of my practice is internal medicine still.
Wow. Okay, I want to go back to what you said about internal tightening.
So this is a unique machine, and what it does, it can go and stimulate the muscle from the inside. So it's the only laser that actually goes inside the mouth, believe it or not, and it stimulates the muscles of the cheeks, and then it starts, doing the tightening of the skin from the outside. And
So
I'll be more than
like
happy.
Botox that way,
it
but
is
it's
not like
still,
Botox,
okay.
but it does really amazing facelift.
Wow.
For the patient without, paying the price of the facelift or going under the knife.
And how often is that usually recommended?
Usually we recommend it for, if you're just starting, we recommend 1 treatment per decade of life. So for example, if you're 40, we recommend 4 treatments, 1 month apart, because collagen stimulation takes around 28 days.
I see.
And then maintaining once or twice a year, because we're still processing, in terms of aging,
Wonderful. So it's so many different levels of treatments that people may not even know about. You would
Exactly.
think Botox is injectable, but there's so many different ways you can
Definitely.
enhance your skincare.
Enhance and definitely maintain practically,
Yes.
without doing drastic changes.
Yeah. And what do you recommend as a woman for starting out, like self-care wise with the face and just overall, right? Like I see younger women at really young age noticing that they want to start doing the Botox, they want to start doing it. But what do you recommend as when is a good time to even do that?
You know what, Botox is very good actually to prevent the wrinkles, when you're younger, and do some volume if the fillers maybe up to age 40. I think really as we age, the Botox is going to wear out and the skin is going to sag more when you're doing Botox. So I highly suggest that around age 30, 35, starting doing some sort of laser treatment to stimulate your collagen, because we know that collagen goes down actually around that age and it keeps going down by 10% per year.
Yeah.
So that's the time that I would highly suggest that people start paying attention, to doing some sort of skin tightening.
Yeah.
So they don't end up with sagging skin when they're around age 50.
Totally makes sense. Wow. It's clear that Dr. Azadi and her team are making a difference in real life of their patients. I want to say thank you, Dr. Azadi, for letting us come and visit your practice.
Of course, and thank you so much for shedding a spotlight on our practice. We are honored to serve our community and help our patients live healthier, happier lives.
There you guys have it, a glimpse of an internal medicine doctor's office, Dr. Azadi. So if you're in the need of healthcare, physician who truly cares about the needs and then provides great services, make sure you come by, check out her website, and make that appointment today.